Welcome to the deep dive. So, we're jumping right in today with a big one, supplements. Specifically, vitamin D for rheumatoid arthritis.
Right. We got a ton of requests on this and, a lot of confusing sources. Things like AI summarized papers that make it sound really simple.
And it's anything but simple. I think our mission today is really about critical thinking. It's about debunking this idea that vitamin D is some kind of primary treatment.
Exactly. And the first sources you found actually set the stage perfectly. They give this initial consensus that, okay, vitamin D may help some patients.
Right, the ones who are already deficient.
Exactly. But, and this is the key, they also say the optimal dose is completely undefined. That vagueness right there, that's our first big red flag.
Okay, so let's unpack that because it really is a scientific debate. You have this cautious optimism at first.
Yeah, there was a 2020 meta-analysis that said supplementation seems to be effective. Then another one in 2021 said it was good for certain outcomes. Lots of hedging.
But then it just gets messy.
It gets really messy. Because when researchers try to pull all the randomized trials together, things start to, well, fall apart. You have a big 2024 review from Denmark and Canada.
And what did that one find?
It found that vitamin D did not significantly lower the key markers that doctors actually care about.
And when you say key markers, you mean all those abbreviations we always see.
I do. The C-reactive protein, or CRP, the erythrocyte sedimentation rate, ESR, and the big one, the DAS28 score.
Which is what they use to measure how active the disease is, right?
It's the gold standard. And that review found no real change in any of them.
But hold on, because you also sent over a 2025 review, this one out of Iran, that said the complete opposite.
The exact opposite. It concluded that vitamin D might actually be good for improving those very same things, DAS28, CRP, and ESR.
So, how can two huge high-level studies come to diametrically opposed conclusions like that?
And that's the core of the critical thinking piece.
Yeah.
When you see two top-tier reviews in direct conflict like this, it's a huge signal.
A signal that what?
It usually means the effect they're looking for is either statistically insignificant in the real world, or the original trials were just too different, too noisy to give a clean answer.
So you have to assume it's probably not making a big difference in the clinic.
You have to. So if the academics are, fighting it out, we have to look at what doctors are actually told to do. And this is where the myth really gets busted.
Well, this is the official guidance.
Right. From the big professional bodies, ELR in Europe and ACR in the US, they put out these massive clinical guidelines. The latest one is 26 pages long.
26 pages on managing RA. I'm guessing vitamin D is all over it.
It's mentioned once.
Once in 26 pages. Okay, that's striking. What was the context?
It had absolutely nothing to do with treating the RA itself. The one single instruction is that patients on steroids need vitamin D and calcium.
To prevent a side effect?
To prevent osteoporosis, exactly. The UK's NHS guidance says the same thing. Supplements are for managing side effects, like folic acid if you're on methotrexate, or vitamin D if you're on steroids. It's not for the RA.
So the takeaway is crystal clear. It's to prevent side effects of the treatment, not to treat the disease itself.
Precisely. And this caution goes even further. Harvard rheumatologist Dr. Robert Schmerling looked at using vitamin D to prevent autoimmune diseases in general.
And
he found the actual risk reduction is just minimal.
How minimal are we talking?
The statistic is pretty staggering. The benefit is about 2.5 fewer cases for every 1,000 people. You would need hundreds of people taking it every single day for years just to stop one case.
Wow, that puts it into perspective. But, it's just a vitamin. It's generally safe, isn't it? We don't want to overstate the risk, especially if someone is actually deficient.
No, and that's a very important point. If you are clinically deficient, supplementation is non-negotiable. You need it.
Okay.
But for everyone else, taking large doses isn't harmless. It can actually interfere with other drugs.
The very drugs that someone with RA might be taking.
Exactly.
Yeah.
And that's really the final thought to leave you with. You have to weigh that incredibly small statistical benefit against the very real potential for drug interactions. You have to talk to your doctor first.